Good morning, Ms. Thompson. Today we'll be demonstrating giving a complete bed bath. This here is going to be Molly, my patient. Sorry she's not any bigger. She's all I had. So, that's her gown. Alright, so first things we're going to do, we're going to introduce ourselves and explain what we're going to do. Identify the patient, allergies, physician's orders, but you don't really need to order for a bed bath. Hello, Miss Molly. My name's Joe. I'll be the nurse taking care of you today. So what we're about to do is we're just gonna give you a complete bed bath, just wipe you down, change your linens. Is there any allergies that I should know of? All right. Can I get a name and date of birth? All right. Thank you. Alright, so we've done all that. Next we're going to gather our supplies. We're going to do some hand hygiene and put on our gloves. And we've gathered a basin with warm water, some soap, and some washcloths. And we've got a few towels here. So what we're going to do, Miss Molly, we're going to take your gown off, and we're just going to drape this towel over you. Here I have the other towel for drying her. Alright. So we're going to go ahead and proceed with the bed bath. So we've got our washcloth with warm water and soap. You always want to, when bathing a patient, you always want to start with the face and then work outwards on the face. So right now we're kind of just going to wipe around her eyes. You could use one corner of the washcloth, wipe her eyes. Rotate sides on the washcloth. You don't ever want to use the same side. You don't want to use the dirty side. We're going to clean her other eye. Like that. And then we're kind of just going to wipe her face. Always rotate sides or just grab a new washcloth. And then lastly on her face or head, we're going to clean her ears. Alright, so let's grab a new washcloth. Now that we've washed her face, you want to wash the patient going from distal to proximal, I believe. So whenever we wash her arm, sorry you can't see too good, you want to start with the fingers and the hands, and then you just want to make sure you get under there, in between the fingers, under the nail beds if possible. And then you want to work your way up the patient's arm, like that. And you always want to make sure and wash the armpits of the patient, like that. Trying to keep her covered. And then when drying the patient, you don't ever want to like rub them down. You just kind of want to pat them dry. Alright, so we're going to grab a new washcloth. And we're going to do this other arm. Same thing, get between the fingers, under the nail beds. Always start at the hand and fingertips and then work your way up. Again, clean the armpits. Grab a new washcloth. Now we're going to move on to the legs. Same thing, you want to work away from the toes all the way up their thigh. So under the toenails, in between the toes, scrub the feet if you can. Then just work your way up to the patient, get behind the knee. You want to just pat her leg dry. grab a new washcloth and grab this leg and wash it. Once again, start at the toes, get in between them under the toenails, wash the feet. If you have extra washcloths, you might even wrap a warm rag around it and kind of soak their feet. Work your way up. Keep her gown on. Alright, and then kind of just pat her leg dry. Alright, for this next part, we're going to clean her chest and abdomen area. So when washing a patient, you always just want to start at the neck and work down. And then when cleaning under her breast, you kind of want to lift with the back side of your hand, just lift the breast and then wipe under there. Make sure it's wiped really good. And then you always want to dry them, dry under the breast. Washcloth. Same thing for the other side, lift it and grab a new washcloth and just make sure you wipe under there, wipe them good, and then again dry under the breast. So you want to lift the back side of your hand and kind of just pat them dry. And then lastly, or not lastly, but, and then we want to work our way down to their abdomen. With a new washcloth, you just want to wash their abdomen. And then if they need help assisting with peri-care, we would get a warm washcloth with soap and water. And then always clean the female patient front to back. It prevents any UTIs or infections or things like that. So you would grab the patient's peri area or labia, and then you kind of just want to, you always want to start cleaning one side first, rotate sides of the washcloth, clean the other side, rotate again, and then from this part you can kind of just go straight down the middle and clean the peri area. So we've cleaned the arms, legs, and front of the patient and her face. So we're going to keep her gowned up. Next, you would set the two of the side bed rails up on that side of the bed because we're going to roll the patient. We want to make sure they don't fall off the bed. So we're going to roll Miss Molly. If we need help turning the patient or anything, we can grab a tech or a fellow nurse. So there she is turned on her right side. We're going to grab another washcloth, soap, warm water, and then we're going to wash her back for her. So we're kind of going to start at the neck. Work your way down. You want to watch for any abrasions, skin tears, rashes, things like that. Also, while we have her turned, you could assess her bottom for any redness or any signs of bed sores or pressure ulcers, anything like that. So we're going to pat her dry. Alright, Miss Molly, come on back over to your backside. And then we would go ahead and roll over to this side. We can lower those bed rails. We're going to raise these. Again, for patient safety, we just don't want them to roll over the bed or anything. And then we would just grab a new washcloth and wash this side of her back if we weren't able to get it all while turning her the first time. So we're going to clean this side of the back. Always pat it dry. we have completed the bed bath, so now we're going to go ahead and grab a fresh gown and remove this towel that we used to kind of cover her up with. And so there we have a fresh gown on Miss Molly. And always before leaving the room or anything, you know, 2 bed rails up, patient safety things. All right, Miss Molly, that was it for your bed bath. Here's a call light. Call if you need anything. Would you like a comb or lotion or anything to kind of just, brush out your hair? Or would you like some toothpaste and toothbrush for some oral care that we could assist you with? And then we just want to make sure they don't have any, they don't need help grooming or anything like that. We want to make sure the bed's lowered in a locked position, 2 bed rails up. And we got a new gown on her. She's good to go. She doesn't want any oral care at the moment, so we're going to go ahead and take our gloves off. And perform hand hygiene, and we are done.